My name is Jess Walsh. I'm a clinical research nurse working for the Blood Cancer Network Ireland. I work in the clinical research facility in the University of Galway. I started working for the BCNI approximately a year and a half ago, maybe a little bit more. I was working in Dublin before that and got the opportunity to move back west, which is where the family are. So I'm a research nurse within the BCNI. With the BCNI is the Blood Cancer Network Ireland. So obviously our patients all suffer with blood cancer of some description. And my role as a research nurse lets me coordinate patients who are on a clinical research trial. So they are using new drugs to try and get better treatments for their cancer, and hopefully in turn in the future those drugs will become mainstream as the gold standard treatment for future patients. So today is Daffodil Day, which is the annual fundraising event for the Irish Cancer Society. Blood Cancer Network is supported by the Irish Cancer Society, so we would like to give a little bit back. So this morning we are having a bake sale and raising funds, valuable funds to go towards the Irish Cancer Society for future research, for patient support, which I know a lot of my patients value and use frequently. So really massively important resource. So obviously I come in first thing in the morning. My patients are treated on the day ward, which is a 10-minute walk to the opposite side of the hospital. So I come in, get my admin ready, get prepared to go and see the patients. It depends on the day how many patients I have. So I go and assess the patients when I get to the ward, make sure they're well, prepare them for their treatment for the day, which they receive on the ward. Put that arm out straight for me there. Yeah. Straighten it up. Good stuff. The shirt's alright.
Yeah, not too bad, no.
Right.
Not too bad, no.
Put that down
Yeah.
straight.
Not too bad.
Put that on there for me. Any news from home?
No, not wrong, no.
No.
There's no, just
Keep on keeping
keep
on.
on going.
Absolutely right. Yeah. So I have been nursing for 20 plus years and started off sort of as a regular staff nurse. My interest in research got sparked. I was working for a team of surgeons a good few years ago now, and they were sort of doing their research in theatres and going off and presenting their findings, and that's when my interest in research began, really, because I was like, well, they're finding all these new stuff out and it's right here in front of us, you know. The patients that we get here who are willing to participate on trials, obviously they get a choice, and we give them all of the information that they need about the trial, whether it's, you know, the risks and the benefits. But it's essentially the gold standard treatment now with the addition of a supplementary drug. So the treatment that they're getting is the best that there is, plus extra. So we then think obviously the drugs that we're giving as part of the trial is going to benefit their care and their disease. Kind of what we're working towards now is the drugs of the future. You know, so the what's cutting edge now and what's the new acceptable best treatments that are being used in current practice, we're now working on the advances for that. So being able to take part in improving patient outcomes for the future is massively important to me. A lot of the patients I have at the moment have been on trial for well over a year. So, you know, you build a rapport with the patients, which is lovely for me as a nurse.
Yeah. You do, right?
We do indeed.
You do look after us, but that's an hotel, like.